Hi, and welcome to another episode of Health Naturally. My name is Paul Gerst, and I am a licensed acupuncturist and natural health practitioner of 16 years and owner of New England Natural Health Services with offices in Plymouth and Norwell. The topic of today's show is low back pain, and later we'll meet Julie Sieben, a chiropractor and yoga instructor who uses both chiropractic and yoga to help her patients with back pain. I'd like to begin by defining some different kinds of low back pain and offering up some treatment options. First, there is simple back strain, which is often from overuse or lifting something a bit on the heavy side. This basically feels like a bruise and is fairly easy to get over. A mild strain will be helped with a hot shower, rest, and/or pain liniment, balm, essential oils, and so forth. A severe strain can make one want to lie on the couch for a while and may lead to the use of cold packs. But again, healing is pretty uniform, and the person suffering a severe back strain is still back on their feet in a few days. A back sprain is often caused by more severe trauma, and the connective tissue around the spine or involving the sacroiliac or SI joints is stretched beyond capacity and is mildly torn and in need of repair. Because a sprain deals with connective tissue, which refers to tendons and ligaments, versus soft tissue or muscle, it is more severe simply because connective tissue is denser and has more weight-bearing responsibility. So when it malfunctions, the person is often in more pain and or more debilitated. Aside from these two problems with tissue, the nerves, bone, or organs can lend to pain in the low back. Compression on the sciatic nerve from various causes may lead to sciatica, or pain along one, two, or all three major branches of the sciatic nerve. Depending on the severity of the compression, the pain may travel into the buttock or all the way down to the foot. Once the source of the compression eases up, the pain will localize into the low back, and once resolved, will finally go away. Some problems may be severe enough that surgery needs to be used to correct the problem. However, more and more studies are pointing to surgery being used in fewer cases and as an absolute last resort. I have seen many different kinds of low back pain in my clinics, and as many cases have been fairly straightforward, a number of patients have presented with stubborn or complicated cases that make treatment long and frustrating for all involved. One of the big reasons for this is that low back pain can be so debilitating and painful, having a few different causes, and thus many surgeons are quicker to suggest the use of their services to borderline cases based on the length of time a patient has had the low back pain and how frustrated they are when they speak to that surgeon. Too many people simply don't exhaust all options or work hard enough to get over low back pain. Seeing a chiropractor is not even exhausting all options of chiropractic care. The same is true of acupuncture or many other types of care. It is often bewildering to me how many people don't apply the same logic when speaking of Western medicine or alternative forms of care. They will see a different doctor who is often just confirming an opinion or giving a different one, but in the case of alternative medicine practitioners, who may offer a very different approach or style within chiropractic, acupuncture, massage, etc., if that person doesn't have success in a few sessions, they not only conclude that practitioner, but often will say that the form of care just doesn't work for them. What does this say about us as a culture and as individuals? Let's get back to the issue of pain. Pain is a message by the body that something is not right. The body may be protecting itself. For example, the person who bends over to pick up a pencil and throws their back out. That pencil was not too heavy to pick up. Well, let's hope not anyways. The fact is, the back had so much instability that the pencil was simply the straw that broke, well, you know what I mean. Accumulated weakness in and around the spine or lumbosacral junction may cause such a powerful pain message to be sent that the patient cannot stand or walk. All of this because the body is trying to protect itself by shutting down the ability to articulate or move the low back. Another reason for pain is to draw attention to a particular area, such as the kidneys. Congested bowels may also cause low back pain too. Pain not only reflects physical issues, but metaphysical issues as well. A powerful example of this is the patient I have seen many a time who presents with pain in the center of the low back, and when physical treatments are applied, the results are often minimal or don't last, even after a series of treatments. But when financial fears are exposed and talked about, especially when alleviated, the low back pain goes away. I've told this story to many a skeptic, and frankly, I am with you. If it weren't for so many practitioners with so many cases supporting it, I wouldn't believe it either. As I often say, use the right tool for the right job. The right job is drawn out by a thorough diagnosis and examination. These underlying causes may cover the body-mind-spirit continuum, as I suggested, and the more layered the case, the more difficult the patient may be to treat. There are other complications such as patient attitudes, stubbornness, impatience, compliance, etc. If a patient comes in with a layered case and is not very motivated, compliant, and say blames everyone else for their problems, they are going to be difficult to treat. That person is going to have to commit to care and find a way to let go, listen to, and follow instructions. If they don't do it, they will either continue to have low back pain or they will end up in that surgeon's office. And I've seen dozens of these cases that surgery did nothing or made them worse. Depending on the cause of the low back pain, one or more approaches may be best. The tissue problems are best cared for by massage, PT, ultrasound, electrical stimulation, hot, cold packs, rest, acupuncture, Epsom salt baths, essential oils, and other topical applications. Skeletal issues are often best treated by a chiropractor. If the structure is causing severe debilitation and the patient is not responding to treatment, a surgeon should be consulted. Visceral or organ issues are best addressed by a naturopath, physician, holistic chiropractor, or acupuncturist. Again, in many cases, the patient will benefit from utilizing different approaches. The key to many of this is exercise, be it in the form of weightlifting to strengthen the trunk and protect the core, or systems that bring together mindfulness, breathing, isometric exercises, and stretches to achieve core strength, such as yoga, Pilates, and even an extreme form of bodywork called rolfing may be used to deeply affect the structure. Why is stretching and strengthening key? Because the majority of low back pain is about instability and weakness. It may be due to obesity, lack of movement, exercise, poor ergonomics such as lifting improperly, sleeping in the wrong bed, poor posture, etc. Or let's not forget dietary issues such as nutrient deficiencies. I'd like you to meet Dr. Julie Sieben, a chiropractor and yoga instructor, and we'll find out what she thinks about back pain and how she helps her patients get well.